Hey guys, I'm Dr. Matt Tonis. If you're watching this video, there's a good chance that you are pregnant or somebody you love and care about is pregnant, and I want to help familiarize you and make you comfortable a little bit with the process that a pregnant patient would go through in our office. So when they first came into our office, they'd be greeted by one of our wonderful staff, and they would complete an intake information questionnaire. And what that's going to do is it's going to give us a bunch of background information about not only the pregnancy, but it's also going to give us some information about mom's previous health history, any previous pregnancies she's had, any type of health concerns that she's had. We're then going to ask particular questions about what maybe brought mom into the office at this point. Is she looking for wellness care just to make sure that she has the healthiest pregnancy possible? Or does she have a specific concern at this time? Is there anything ailing her? Does she have lower back pain, pelvis pain? Is the baby in a breech position? Is she struggling with any different types of development issues throughout this pregnancy? So we want to learn about all those particular facts and experiences that the pregnant patient is going through at this time. At that point, typically what will happen is one of our doctors will begin the examination process with the pregnant patient. And that examination will not be able to include x-rays, as we know that during pregnancy, x-rays aren't something that are well tolerated with a growing, developing, rapidly cell dividing fetus. And so we don't use x-rays during that time. So all of the other elements of the examination are completely safe and friendly and comfortable really as far as things go for a pregnant mom. So whether it's early on in the pregnancy, just a couple weeks in, or whether or not you're towards the later end of the third trimester, we have special pregnancy tables that adapt to be able to make room for the abdomen of the growing pregnant mom. We have special tests that we will do to check pelvic alignment, check lumbar strain, check any compensatory types of loads that could be happening in the upper back and the neck. Talk about and discern whether or not different hormonal changes at stages of pregnancy are impacting where you're at right now. We'll be able to assess for alignment. We'll be able to assess for sacral rotation, which directly impacts whether or not the uterus is sitting in a twisted or a neutral position. That's called in utero constraint. And so we want to make sure that development is given every opportunity possible. After we've completed all of the different types of evaluations that we would do on a pregnant patient, at that point, we'll decide what the right strategies for you are in terms of trying to improve that. There's many different angles that we can approach things from, whether it's chiropractic adjustments exclusively, whether we need to use certain stabilization exercises, whether or not we need to discuss certain stretches. There's all kinds of different things that we can do in terms of supporting you with your pregnancy. We'll even go as far as to be able to help you with certain types of nutrition or supplement recommendations if those are things that you have questions with as well. We look forward to meeting you, and we'll be happy and blessed to be a part of your pregnancy.